Patterson works with CHCs in very close partnership. I would say that we are consistently checking in on them. The services we provide are to keep them running, and it really depends. I mean, we have a strong team that supports them. That's the equipment specialist, the territory manager, as well as the service team. But we work very, very closely with them, most importantly, to keep the clinics running on a daily basis.
Yeah, there's a lot of flow going through community health center. We have to accommodate for elderly and children. They see a lot of children through community health. So you'll notice when you take a tour in the space, they have more closed off private rooms. The hallways are a little wider than you normally would see in a general practice. So just the overall volume to be able to accommodate that, we made the operatories a little bigger and a lot more private.
Patterson brings a lot of values to the community healthcare clinics. We have a lot of tenure with our team. Our equipment specialist on this particular program worked very closely with them from the ground up. And I've been able to sit with him and listen to him have these conversations, and the wealth of knowledge that he provides just off of the top of his head from the experience that he's had building well over 10 community healthcare clinics just in the Bay Area. That experience is extremely valuable when you're planning a clinic like this. He asks a lot of great questions. He understands how they work throughout the day. He understands their workflow, understands not only how they're currently working, but their future goals. And those are very important considerations to have when you're building a project like this.
We've done several clinics throughout the Bay Area. Personally, I've probably put together 10 plus community health centers throughout the Bay Area. We've had success, and I've also seen the failures of equipment over the years. They need equipment that's reliable because just the volume, the sheer volume that they have coming through. Downtime is real expensive for them, as in any clinic, but especially for a community health center. So we make sure we select equipment that's reliable, that's easy to fix, and the technology that they can adapt to have multiple services within their practice. They're bringing multiple disciplines into the practice as well. They're starting to, so we had to accommodate for that. One of the things is they're putting in 3D cone beam, so they'll be able to provide endodontic services. It makes it expanded functions for their practice. So we brought that in. They see a lot of children, so they usually like the nitrous oxide plumbed into their space where the hoses are not exposed and the clinicians can have better access to the patient. The way we design the workflow is super important just because they have multiple doctors here at one time and they're not running into each other. The way we design the sterilization, we have a designated dirty and a designated clean side. There's a flow to that. So it's important to be able to accommodate that, especially for such a larger clinic. We have a great team, and I think it takes a team to be able to build something like this. Patterson is known for accommodating these services for community health centers just because we do have a great team. We work with all types of architects, builders, contractors, plumbers, you name it. We have vast experience with that. And we bring that knowledge base on board, just makes the project run much smoother.